To be here. It's my first time ever in Nashville, and there's my old friend Peter Hudson. Hi, Dr. Hudson. And to be here also to see my good friend and one of my most important and favorite interlocutors, Jonathan Metzl, at his new digs here at Vanderbilt, and to be able to join and to participate in the important conversation that that the Center for Medicine, Health, and Society is doing. So I'm really honored by the invitation. And I want to say thanks as well to Len Lentz, who might have already left, for helping me to get here today. So what I'm going to talk to you about today is sort of an overview, a sort of broad strokes gloss of this book that's just come out called Body and Soul, which was my dissertation, which I've been working on dutifully for more than a decade. So the graduate students in the house, you know, hang in there. You do get finished eventually. And so let's see, maybe I'll stand over here so I can both do my slides and the paper at the same time. Okay, so health is politics by other means. And you'll maybe recognize that I've borrowed that from Bruno Latour, who says that science is politics by other means. Milestones in health and medicine are conveyed as bearing on the broadest political and social ideals. The recent 10th anniversary of the decoding of the human genome, for example, brought with it cautious hope for the progression of genetic science from the lab bench to the bedside. This scientific landmark was notably accompanied by then President Bill Clinton's proclamation that this feat had established our common identity. Health is also deemed to embody conceptions of the good society. In 2010, the administration of President Barack Obama ushered in historic healthcare reform with the Patient Protection and Affordable Care Act. At the time of its passage, this legislation marked the most sweeping changes in U.S. health policy since the establishment of Medicare and Medicaid in 1965. The Affordable Care Act, which promised to extend medical benefits and coverage to tens of millions of previously uninsured and underinsured Americans, was passed despite heated partisan debates redolent of the political battles over health policy of the 1960s. The controversy that preceded and then followed the implementation of this act concerned far more than bodily well-being. Underlying the impassioned back and forths that pitted accusations of socialized medicine, government takeovers, and death panels against assertions of a right to health and the ethics of universal health care were stark ideological distinctions: Republican versus Democrat, laissez-faire versus interventionist, libertarian versus progressive, among others. In other words, health care reform was the dialect through which fundamental political disagreements about the proper function of the state and the appropriate parameters of business influence were articulated. And so this is just recent slides. This is one about Obamacare, and the other is from Doctors for the 99%, who've been participating in the Occupy Wall Street movement in Zuccotti Park for the last several weeks. Health over wealth. This is a doctor from Montefiore Hospital in New York City. In the late 1960s, a group of black radicals would take up the politics of health in ways that anticipated these debates. The Black Panther Party for Self-Defense, founded 45 years ago by Huey P. Newton and Bobby Seale, who are pictured here, is generally remembered for what this image conveys: its black berets, its revolutionary rhetoric, and its shootouts with police. The Black Panthers' health activism is less well known. This little recalled aspect of the party's work, nevertheless, remains one of its more durable legacies I want to suggest to you this afternoon. Newton and Seale set out to champion and protect black communities. This ambition too often devolved into violent confrontations. The Black Panther Party's protective impulse was perhaps more productively channeled into campaigns of what we might understand as medical self-defense. The party fought to shield disenfranchised communities from exploitative medical research, and in addition to safeguarding the poor from bad medicine, the party also disseminated health education and dispensed medical care. Over 3 days in the spring of 1972, the Black Panther Party held a Black Community Survival Conference, a gathering that combined elements of a street rally, a fair, and a block party in that city's DeFemery Park, which is also known as Little Bobby Hutton Park, for a member of the party who died in its early days. On March 27th, standing before a large banner carrying the slogan, "Serve the people, body and soul," Black Panther Party chairman and co-founder Bobby Seale spoke on a public address system to an assembled mass of Panther loyalists loyalists, political allies, locals, police, and passersby about the organization's slate of free community service programs. Called survival programs, the activists established these community initiatives in part to help poor blacks cope in the face of the surveillance and harassment they experienced at the hands of agents of a mounting law and order state. On the other hand, these programs were intended as a stopgap solution to the diminished provision of social services by a shrinking welfare state. So this is from their newspaper. You see the banner, Serve the People, Body and Soul, which is where the book title comes from. This event was in March of '72, and this is from a newspaper clipping from May of 1972. At stations throughout the park, against a backdrop of barbecuing, children's presentations on Black and radical history, which are pictured here, speeches by members of other activist groups such as Donnie Tillman of the National Welfare Rights Organization, a performance by the pioneering a cappella group, The Persuasions, and other entertainment, Black Panther Party cadre and volunteers distributed information about the more than a dozen no-cost community service initiatives, including escorts for senior citizens to medical appointments, free elementary education at its school in Oakland, and a bus service to prisons for visits with incarcerated friends and family, to name only a few. Concurrently, Panther members showed Seal's words in action that day, handing out free bags of both food and clothing to an appreciative crowd. So this is the backdrop of that stage at this Black Community Survival Conference. It gives you a sense of the scale of it, and there's the bags of groceries there in the background. On the same weekend, at the same event, the Black Panther Party also held a voter registration drive in anticipation of a May 1972 announcement of Bobby Seale and Minister of Information Elaine Brown's respective candidacies for mayor and 6th District City Council seat on a community survival ticket in upcoming Oakland elections. Accordingly, this gathering and the subsequent survival conferences that also occurred this year have been interpreted by some scholars as marking the Black Panther Party's de-radicalization, a shift in the organization from revolutionist to reformist principles, and from radical militarist tactics to mainstream electoral politics. Less remarked upon, however, in the historical and sociological record is the fact that this episode was also an important signpost in the party's health politics. So those are food at that same event. And these are all photographs by the incredible photographer Stephen Seamus. At this event, the breadth of the Panthers' health-focused activism was evident. Party members publicized the activities of the People's Free Medical Clinics. Black Panther members touted their grocery giveaways as ameliorating the malnutrition that often accompanied poverty and thus as contributing to community members' healthfulness. Working with their collaborators and also volunteers, the activists reportedly screened thousands for sickle cell anemia, a genetic disease that predominates in persons of African descent. The extent of these activities confirms that the provision and politicization of medicine was a significantly developed feature of the Black Panther Party's broader mission. Moreover, in the same month, Black Panther co-founders Newton and Elaine Brown, the group's chairwoman, amended the organization's founding 10-point platform to include a revised point 6, a demand for completely free health care for all Black and oppressed people. So this is how many people knew that who knew about the Black Panther Party knew that there were two 10-point platforms, one in 66 and one in 72, a couple people. So most people don't know that. And this is the 1966 version. And what I suggest in the book is that there has always been a sort of interest in community issues and community concerns, right, from the very beginning. And that the health activism that I write about is a sort of heightening of interests that were always important to the party. So you'll see here from the 66 platform, we want decent housing fit for shelter of human beings. Point 10, we want land, bread, housing, education, clothing, justice, and peace. So in 1972, they would make some revisions, and this is the revision, of course, that's most interesting to me in the 10-point platform, an explicit sort of assertion of a right to health, right, and a right that the state should either provide health care or get out of the way. You'll see the last line says, they want research programs developed to give all Black and oppressed people access to advanced scientific and medical information so we may provide ourselves with proper medical attention and care. So it was, on the one hand, a demand, some of their politics was a demand for sort of a single-payer universal healthcare system, and some of it was also a kind of self-determinist politics that was sort of cynical about what the state could provide for Black people, given the history of race and healthcare in the United States. So how and why did health politics come to play a significant role in the Black Panther Party's health activism? These questions are the subject of my book and of my talk this afternoon. And in the time I have, I want to discuss the ways in which health issues, broadly understood, would come to become, in these 6 years from 66 to 72, an indispensable element of the party's politics. The moral authority widely accorded to opponents of anti-Black Southern racism derived in large measure from the Christian pacifist principles that undergirded their nonviolent tactics. In the mid-1960s, when Black radicals employed the uncivil tactics, such as armed confrontation with police authorities and denunciation of state-sanctioned institutional racism, the issue of health imparted a new moral mantle to their efforts. Health was a powerful and elastic political lexicon that could signify many ideals simultaneously. In settings where racism was more commonly advanced through social abandon, such as the lacking or insufficient social welfare programs and social control, such as police harassment or medical mistreatment, than through Jim Crow practices, health was a site at which the stakes of injustice could be exposed and a prism through which struggles for equality could be refracted. Health could also connote inalienable human attributes and freedoms. Martin Luther King Jr., for example, invoked the idea of health as both the fundamental and paramount property of human life during an address before the Medical Committee for Human Rights in 1966. Of all forms of inequality, injustice in healthcare is the most shocking and inhumane, King proclaimed. The Black Panthers would translate the polyvalence of health into practical social programs and to a political ideology. So I want to suggest, and I'm going to talk more about the how the health politics was carried out, but I want to say a little bit about what my hypothesis is about the why. So I want to suggest to you that the origins of the Black Panther Party's health activism lie in some founding ideological influences, some internal organizational dynamics, and some historical continuities. So first, one of the things I do in the book is I spend some time thinking through the contributions of Mao Zedong, of Che Guevara, and of Frantz Fanon to the Panthers' work, right? So typically we think about Fanon is taken up to be the sort of model of violence that the Black Panther Party had, and to suggest that it was sort of only through violence that revolutionary struggle and sort of true freedom for racially oppressed people could be accomplished. Similarly, Mao is usually written through the Panther story with regard to the fact that the Black Panthers in their early days sold Mao's Little Red Book in Oakland and at the UC Berkeley campus to raise funds in its early days, and also that they used many of his aphorisms that were in the Little Red Book. But as I suggest in the book, there are that these sort of founding sort of political thinkers made available to the Black Panther Party kind of health political ideas that are underappreciated. And that if we think about this more seriously, the fact that the Panthers would develop by 1972 a sort of robust health politics is not a surprise. So for starters, Fanon and Guevara were both physicians, which is not remarked upon often. And Fanon and his works, both in The Wretched of the Earth and in A Dying Colonialism, particularly in A Dying Colonialism, spends a lot of time, and in fact in the latter a whole chapter, talking about medicine as an instrument of colonialism, right? And the Panthers would actually take up in their newspapers, particularly the Los Angeles Panthers, the sort of technique of the case study. So in A Dying Colonialism, in this chapter on medicine and colonialism, Fanon has these physician's case studies. So he says, Algerian man, 23, comes into my office, is suffering with X or Y. And then the diagnosis that he offers is a political diagnosis that's about the colonial condition. And the Black Panther Party in Los Angeles did a similar thing. So they would talk about political prisoners in Los Angeles and the care that they were receiving or not receiving when they were taken in by the police. Similarly, Guevara offers for us not only the fact that his sort of political theories come out of his positionality as a physician, but also that the idea that medicine was central to the revolutionary struggle. So there's a wonderful moment I think it's in the Motorcycle Diaries, in which Guevara is talking about a moment where he has to choose between his doctor's bag and his sort of ammunition, and he chooses his ammunition, of course. And the revolution in Cuba proceeds, but it's also the case that he understood and talked and wrote a lot about the importance of medicine to revolutionary practice. And lastly, Mao, in addition to providing pithy aphorisms that the members of the party were required to know as part of their political education, also made available to the Black Panther Party is the idea of the lay health worker. So many of the Black Panther Party's clinics that I'll talk about were staffed by lay people, by community health workers, effectively, many of them self-trained. And I won't be able to say much about it today, but the Black Panther Party, two coteries or groups of the party traveled to China in the 1970s and actually toured hospitals in Maoist China, and also were trained with the barefoot doctors in Maoist China. And one last thing I'll say about that is one of the people I interviewed, a physician who helped to direct the Black Panther sickle cell anemia campaign, and he was the physician D'Angela Davis and Huey Newton, among others, would learn acupuncture on one of these trips to China. And if you go to his clinic now in West Oakland, on the second level of his clinic, he has 2 rooms in which he still does acupuncture, and instead of the sort of Gray's Anatomy charts, they're meridian charts in that office. So those were important sort of health political effects that we don't talk about. Secondly, the origins of the Black Panther Party's health politics lie in their organizational dynamics, right? Large organizational dynamics, including state repression and retaliation programs such as the COINTELPRO program, which was both a federal and often practiced locally program to infiltrate and basically decimate the Black Panther Party as an organization. Of course, there were incidents of violence that were initiated by the party, and of course, there were fatalities that resulted that occurred as a result of this. And partly the shift and emphasis to the health activism was a response to this. And I have one slide I'll come back then. So in the book, what I do is link this to the fact that many of the clinics, in fact, all of the clinics would be named for sort of Black Panther Party martyrs. So this is a flyer that I got from an LA Panther. She gave to me from her personal archive. That announced the opening of the Al Prentice Bunchy Carter Free Clinic, and this was named for Bunchy Carter, who had been killed in an altercation with the S organization on the campus of UCLA, some of you might recall. So there was a way in which the clinics and the health programs, in their very naming, reflected the cost of violence, the toll of violence that its toll in the party. So to go back briefly. And then the origins of the party's health politics, of course, lie in interorganizational conflict, right? So by early 1970s, there's a division in the party about whether the party should proceed as a sort of underground guerrilla group, which was the position that was supported by Eldridge Cleaver, while Newton and Seal and Elaine Brown, as she came to take a larger role in the party, supported more of the social programs. And by some accounts, this conflict pivoted on the import and the expansion of the social programs. Lastly, there were important historical continuities, right? So in the book, I talk a bit about what in the sociological literature is called social movement spillover. So I situate the Black Panther Party not only in the sort of contemporary health politics that was happening at the time, so the women's health movement, there were hippie clinics in the Bay Area and the like, but I also make an argument that the Black Panther Party extended a tradition of African American health activism that goes back to slavery, although in the book I'm particularly interested in the 20th century. And I want to suggest that this tactical repertoire, which included things like fighting against discrimination in the medical professions, the Black hospital movement, and these sorts of things, made available to the Black Panther Party what I call combining 2 literatures, the long medical civil rights movement, right? So that we can understand the Black Panther Party, that their health activism doesn't just come out of nowhere, right? It comes out of a tradition of African American health activism that was part of an anti-racist politics that goes way back in American society. So continuing, the Panthers were heirs to a mostly uncharted tradition of African American health politics. Health advocacy, variously conceived, has been a deep-rooted concern of Black political culture across the range of institutions, community organizations, and social movements that constitute this protest tradition. The Black Panthers' health activism was a signpost in the long civil rights movement, as well as a manifestation of a long-standing tradition of African American health politics. This legacy was evident in the party's own tactical repertoire that drew on the example of Black communities' prior responses to health inequality and medical mistreatment. The party was firmly rooted in a tradition that had developed during slavery and interface with how bondage, racism, and segregation affected the well-being of Black communities. During the 20th century, Black health activists fought for access to humane and equitable medical treatment from the progressive era, during which Black leaders endeavored to dispense healthcare services for their communities in the face of institutionalized Jim Crow by establishing hospitals that, like disease, did not abide a color line. To the 1950s and 60s, during which reformers staged a medical civil rights movement to desegregate medical schools and workplaces. So for example, although the Black Panther established independent health clinics, its establishment of independent health clinics was in keeping with, as I said, the community control and determinist ethics of the 1970s, both of things similar to the women's health movement and also to 1970s Black nationalism. This alternative institution building also harked back to early 20th century endeavors such as the Black hospital movement. In these ways, the Black Panthers employed tactics that were demonstrably derived from a line of Black health advocacy that had developed in response to racially segregated medical institutions and health professions. So some of the most shocking photography and television footage of the civil rights struggles of the 1950s and 60s depicted activists being hosed down, shot, attacked by dogs, and otherwise abused. This is Birmingham, 1966. This is one of the great photographs of Charles Moore. Although these images brought into open the terrible recalcitrance of the Southern white power structure, they also beg the question of who would care for those wounded on the front lines of the battle for civil rights. Could activists who risked life and limb by merely attempting to sit at lunch counters and in bus depots in the Deep South realistically rely on local health professionals for emergency health care? Would the limited number of Black doctors practicing in the South, owing to decades of discrimination in the medical profession, be sufficient to heal activists taken ill during the normal course of their organizing labors or critically injured on the front lines of the Black freedom struggle? For the strategists behind the 1964 Freedom Summer Project, a landmark event of the Black freedom struggle, the answers to these questions was decidedly negative. Accordingly, planners of Freedom Summer sought the participation of students and medical workers alike. Although dispatched to support the summer volunteers, medical activists were unable to ignore the impoverished conditions in which many rural Mississippians were forced to live and were distressed by the paucity of adequate healthcare services. Many Freedom Summer volunteers, returned from the trenches of Mississippi politically radicalized, and this was also true of the health and medical volunteers. Health radicals who participated in the SNCC Medical Committee for Human Rights Collaboration, such as physicians Quentin Young and Terry Coopers and William Bronston, who would start the student health organizations, went on to work in Black Panther health clinics, work on Black Panther health projects, including its free medical clinics. Quentin Young would work in the Black Panther Clinic in Chicago and Terry Coopers in Los Angeles, respectively. A February 1970 issue of the Black, so these are also the continuities I'm talking about, and there's a way in which we think about the division between the civil rights movement and the Black Power movement, and I think looking at the Black Panther Party through the prism of health activism actually shows that there are ways in which this distinction is a false one, right? So you have sort of SNCC becoming the Black Power movement, both with regard to these figures like Quentin Young, who would who would work in both movements, and people like Jack Geiger, who some of the people who work in health in the audience will recognize, and also people like Stokely Carmichael and other figures who would go from SNCC to the Black Panther Party as well. A February 1970 issue of the Black Panther, the party's newspaper, featured 2 articles that dramatized how mainstream medicine could fail poor communities. One account told of the untimely death of James Anthony Nero, an African-American infant in Brooklyn, New York. Suffering from fever and chest congestion, James was taken to the emergency room of a local hospital. Doctors hurriedly examined the baby and allegedly sent him home with medication, but without a proper diagnosis. Several days later, James was discovered unconscious by his mother, Hattie. Taken again to the emergency room, the infant was pronounced dead on arrival. He was 4 months old. A photograph of baby James in his tiny casket accompanied the story in the Black Panthers newspaper, and of course visually harked back to the small casket of Emmett Till that circulated in the Black press a few years prior. The Black Panther piece conjectured that getting to the essence of James's tragic death necessitated a consideration of, quote, the circumstances surrounding it. Criticism was especially heaped on the failed social welfare system, The Black Panthers' account of this incident underscored the fact that the Nero family lived in Brownsville, a Brooklyn neighborhood so neglected by municipal services that, quote, garbage piled up, attracting rats, mice, and roaches, close quote. The diagnosis that had allegedly eluded James Nero's doctors was then ventured by the party. The newspaper declared that, quote, pneumonia and flu viruses run rampant in impoverished settings like Brownsville. A second article in the same issue of the Black Panther newspaper employed anecdotal vignettes to depict the dismal state of healthcare services for the underprivileged in the Bay Area, shining a light on the disrespectful, unprofessional, and even often authoritarian encounters between physicians and their patients at San Francisco General Hospital, a public teaching hospital affiliated with the University of California. This article's unnamed author declared that this public facility should not be regarded, quote, as a charity hospital because there is no charity practice there, close quote. Represented as typical of this hospital were patient-doctor interactions such as the one described here, quote, the intern who examines you at first at least says hello, but the resident who comes in to check up on him hurts you and ignores you. He talks to you as though you weren't there, close quote. Affronts to women seeking reproductive health care at San Francisco General received extended consideration in this article in its portrayal of the many hurdles and indignities faced by a hypothetical impoverished pregnant every woman of color who was getting by with Medicaid assistance. Shuttled between prurient social workers and public health nurses, poorly managed municipal health facilities, and callous physicians depicted as lobbying expected mothers to choose abortion over childbirth, and waiting for hours to be seen in each instance, poor women's pursuit of maternal care was seen as a frustrating, coercive, and demeaning affair. Running side by side in the newspaper, these two articles encapsulated the activist interpretation of the challenges confronting medically underserved communities, including inadequate facilities, negligent care, paternalistic and sexist interactions with medical authorities. More particularly, dealing as they did with the pragmatics of healthcare, the People's Free Medical Clinic, the newspaper account offered ready justification for the formation of the Panthers' own independent clinics. Quote, our people are dying of medical miscare. We must work to make the People's Free Health Clinics a reality. Disproportionately incarcerated Blacks and Latinos were subject to medical abuse and experimentation, the newspaper also noted, such as that took place at Pennsylvania's Holmesburg Prison in the early 1950s and to the early 1970s. Further, the circulation of patients' accounts of being treated like, quote, animals at, quote, butcher shops and, quote, butcher houses, some accounts actual, many apocryphal, eroded public faith in mainstream medicine. As it was put in a June 1970 newsletter published by the Los Angeles-based Southern California of the Black Panther Party, quote, poor people in general and Black people in particular are not given the best care available. Our people are treated like animals, experimented on, and made to wait long hours in waiting rooms, close quote. That this accusation was warranted was crystallized for many skeptics following the New York Times disclosure in 1972 of the 4 decades-long Tuskegee syphilis study, in which close to 400 African-American men were left untreated for the disease so that researchers could observe its ravages on the human body. So this is from an August 1972 issue, front cover of the Black Panther Party's newspaper. The Black Panther Party, people will often ask me, did they start doing health activism after the revelation of Tuskegee? And no, they started doing their health activism well before, but it was a sort of moment, that sort of solidified and highlighted for them many of the things that they had been saying about healthcare and race in the United States for at least 4 years before this disclosure. So in April 1972, Bobby Seale issued an organization-wide directive that all party chapters establish local free healthcare facilities. So the party starts in 1966. By 1967, Huey Newton is incarcerated for, I think he's set free eventually. He's not charged for the crime, but he's in jail for over a year. And so the party is expanding and it's coming to national attention, and only one of its founding leaders is sort of in the day-to-day workings of the party. So this mandate would be issued in 1970 by Seale, and apparently in consultation with Newton. And they were also trying to, by 1970, to get a handle on the fact that chapters were springing up all over, both in the country and internationally. And so part of what they were trying to do were to say, like, if you're going to have a chapter, you have to have these things, right? So you have to have a free breakfast program, and one of these things were that all chapters had to have a clinic by 1970. So called the People's Free Medical Clinics, the resulting facilities became the infrastructure for the party's health programs. So this is Bobby Seale at the Berkeley People's Free Medical Clinic, which was the one closest to the Black Panther Party headquarters, and it would be one of the last ones to be started. They sort of ironically started their chapter late. But you'll see that there are sort of medical images sort of on the wall. There's some sort of medical device on the table there. I write a little bit in the book about the presence of Panthers wearing white coats. And a lot of the feminist healthcare movements, feminist health clinics, and sort of the sort of hippie clinics that start, like the free clinics that start in the Bay Area, it was important that people didn't wear white coats. There was a sort of sense that people should be dressed like the rest of the people. But for the, it's interesting, for Black communities and for the party, it was important to sort of have this sort of sartorial representation of sort of medical expertise. So this is a flyer announcing the grand opening of Bobby Seale's People's Free Health Clinic. It would be later renamed within a month for George Jackson after he passed away, after he was killed. So the plan to extend the clinic program was first announced by the party's Minister of Education, Ray Masai Hewitt, in this article from the Daily World in 1969 called The Panthers' Map of People's Medical Plan. Clinics were launched as early as 1968 in several cities, including Kansas City, Missouri, Chicago, and Seattle, with Portland following suit in 1969. The Los Angeles chapter's Bunchy Carter Clinic was located in the Watts neighborhood and opened in December 1969. Soon after Seale's clinic mandate was handed down, clinics were launched in New York, in several of the boroughs of New York City, Cleveland, Boston, Winston-Salem, and Philadelphia. The New Haven Clinic, New Haven, Connecticut, opened in February '71, and the medical clinic located closest to the Oakland headquarters, as I said, didn't open until the spring of that year. The Panther clinics eventually spanned 13 cities, with New York City and Portland having more than one clinic. The clinic served a broad base of operation for the party in at least two ways. They were, as I said, the sort of infrastructure of the party, and they were also kind of these ecumenical spaces where medical care was administered along with other kinds of social services, right? So medical care was the central aim, but not the sole aim. And local residents could receive assistance from what was called a patient advocate, a party member or volunteer on matters about physical health, housing issues, and legal aid. So there was a broad-based serve the people agenda that was carried out at the clinics. So I'm going to show you a few slides now from the clinics. This is the Franklin Litch People's Free Health Center in Boston, which was, as you'll see, was run in a trailer. So Bobby Seale makes this mandate, but the party headquarters provides no resources for the clinic setups. And so each of the chapters have to use their own ingenuity, and come up with their own resources to set up the clinics. And the Boston clinic did theirs in a trailer. This is the interior of their clinic. This is a flyer from the Seattle People's Free Medical Clinic. That was open Monday through Thursday, 5:30 to 9 p.m. They were often open in the evening where people could come after work, and often medical students and doctors could come after their rounds to work in the clinics, volunteer their labor. The clinics basically were often responding to local needs. So in the case of the Winston-Salem chapter, they were the one Black Panther chapter that had an ambulance service, and it responded to the fact that the ambulances wouldn't come to certain neighborhoods in Winston-Salem, and they would sort of ask people lots of questions, and then on top of that, people had to pay, even if they could get the ambulance to come, and often people didn't have money to pay for the service. This is the Los Angeles, so this is actually the Los Angeles the Bunchy Carter Clinic sort of carrying on after the clinic is destroyed by a police raid sort of the night before. So you can see there's a sort of makeshift handwritten sign. The woman with the afro is Marie Branch, who was a UCLA nursing professor who helped establish the Kennett clinics. This is from that same article. The doctor in the foreground is Terry Coopers, who was involved with the SNCC Freedom Summer campaign and then helped to set up the clinic in Los Angeles. So this probably goes without saying, given the pictures, but the Black Panther health activism and all of their activism was multiracial, interracial activism. This again is the white coat. This is Marie Armour actually checking a TB test that she had given a little girl in her home in Oakland. All right. So at its clinics, the Black Panther Party highlighted the problem of sickle cell anemia disease, an incurable genetic condition that occurs predominantly, although not exclusively, in persons of African descent. Its campaign, launched in 1971, was a response to what the party perceived as the deliberate and pernicious neglect of African American citizens by the healthcare state. And in response, the Panthers established their own free genetic screening for sickle cell anemia trait and disease. In keeping with the democratic principles of the party's health politics, the genetic screening program relied upon the labor of Black Panther Party cadre and community members, in addition to that of volunteer medical professionals and often medical students, medics who had been trained in Vietnam and the like. So there's a woman here getting her finger pricked for a sickle cell anemia test, and you can see in her lap is a flyer that says, "What is sickle cell disease?" The Black Panther Party did a lot of actual quite good sort of public health education around sickle cell disease. So I'll just show you a few slides. So as I mentioned earlier when I was talking to some students, part of what's interesting for me in a sort of geeky technological way is that what enabled the Black Panther parties to do this genetic screening was that the year before a test called SickleDex was developed that was inexpensive and that non-experts could use and didn't have to take place in the laboratory, and allowed them to do tests by the hundreds and, as they claim, the thousands in public places, public venues like the Community Survival Conference. And this is taking place at one of those conferences. They've been critiqued. Ruth Schwartz Cohen, for example, has critiqued the Panthers for not doing sort of adequate genetic counseling and follow-up, and often confusion between the sickle cell anemia disease and sickle cell anemia trait. And I think that's true to some regard, but you can also see both on these slides that there was fairly careful paperwork being done, so people's names were taken. And a couple of the clinics, the Berkeley Clinic, for example, had their own electrophoresis machine, so they could do more detailed analysis. They could take the samples from these large events and do more refined testing on them. This is more sickle cell anemia testing. All from these community life events. And this is the sort of table. This is an image of this table placard that talked about the disease. They wrote often about children who suffered with sickle cell anemia and wrote from the perspective in the newspaper of children. In the background of this boy are shapes of sickled cells, and this image was done by Emory Douglas, who's the sort of artist created the kind of visual identity, Minister of Culture. This is a chart that ran in the newspaper showing the inheritance, how sickle cell anemia trait and disease, carrier status and disease was transmitted. Accurate chart in their newspaper. And this is a slide from part of how they did their public education. And to me, this is one of the more interesting sort of artifacts of their sickle cell anemia campaign. It's a screenshot from the Mike Douglas show in 1972.